I teach at Pankey, and I have for years, and I've got to tell you, I think one of the things that we do as dentists really well is we make occlusion seem so difficult that we even confuse ourselves. And so keeping that in mind, I think it's important that we understand that occlusion really can be quite simple. Here's what we're after. We want as many of the back teeth to touch at the same time as possible in a centric relation arc of closure. We do that simply to create and to distribute contacts so that not one tooth is getting beat up. Secondly, when we apply power, we don't want teeth to deflect. In other words, I want teeth to touch on flat receiving areas because it is the deflection that creates wear, that triggers muscles to be more active, that allows bad things to happen. And lastly, when the jaw goes side to side, back teeth come apart. That's all there is to occlusion. And I think sometimes we can make it so hard. So given that, let me share with you what I consider the ideal concepts of occlusion. First of all, we want to create an incisal edge length that is aesthetic because that's what drives our treatment plans. But we want that to work within that patient's individual envelope of parafunction. We want back teeth to come apart as soon as the jaw goes side to side, and we want that angle of disclusion to be as flat as possible while allowing the back teeth to come apart. And if we can do that, we have an aesthetic outcome, we have decreased the muscle activity, which is good, and we have created a more stable situation that gives us better long-term predictability.